Is she okay? She's
Hi everyone, Maria Trusa and Gina Capelli.
here. I am back again.
Yes, Reflect and Reset with Maria and Gina. As you know, we go live every Wednesday, and the idea is to bring you information that is valuable to you and your family. And one of the things that we're going to talk about is we have a special guest.
Yes.
Gina, you want to make the introduction
I
as usual?
So, you know, and as Maria was saying, we always like to bring information to you guys so that you can better yourselves and learn from us to be able to take care of yourself and your family. So we have Tania Weiss here, and Tania is the Executive Director, right, at the Cancer Support Team. And before we get into what the Cancer Support Team does, we're going to ask you, Tania, a little bit about yourself.
Well, I've been a board member with Cancer Support Team since 2008, but previously, and most of my work life, I've been in television production. And we did, my company, Weiss Productions, did the video for, one of the first videos for Cancer Support Team all the way back in 2006, and that's how I got involved with them. And I just have been part of this agency for a very long time and have loved it and feel like it's an unknown jewel in Westchester County, and I'm just thrilled to be here. Thank you for inviting me.
I'm so glad that you're here. And so tell us a little bit about what the Cancer Support Team does.
So we are a New York State Department of Health licensed in-home care agency. All right, that's a mouthful, right? So what we have is a team of experts who help you when you have a diagnosis or at any stage of your cancer with nursing, counseling, case management, rides to and from your treatment, and small financial grants. All of those services we offer at no cost.
Oh, wow.
Yeah, at no cost. And so really what it is we partner with your medical team and help you in numerous ways so that we meet our mission. And that mission for the last 40 years, yes, 40 years, has been to enhance the lives of anyone who's diagnosed with cancer in southern Westchester.
Gina, one of the things that I've been saying is before I joined this mission with you, that I didn't realize, because I was working inside Scarsdale Medical Group for 26 years, I didn't really get out in the community. But as I'm getting out in the community, I see how much good people are doing out there. I mean, and that's the idea. When we met, I said we have to make sure that we bring this information out to the community, because we have seen even our own staff
And family staff.
Staff, and we've seen people that have been our staff actually that have gone through cancer and struggle. And they don't know, even we didn't know that you existed, and that's why it's so important that.
So here's the deal. In New York, in Westchester County, over 100 people are diagnosed with cancer every week. That's a big number.
Every week.
And it's above the national average. But what's interesting also is that in Westchester County, our mortality rate is lower. So when you combine that, that means more people are diagnosed, but more people are living with cancer. It's kind of like a chronic disease. And so what's really important is that it's hard. When you hear that diagnosis, you need often assistance, and not just with how to handle the things that are going on with your body, but it affects your whole family. It certainly is going to affect your caretaker, and it's going to maybe affect you financially and certainly emotionally. And so we are there to take that walk with you. You know, when you're at the doctor's office, God forbid, and you hear the word cancer, I don't think you hear very much after that.
Right.
You know, that whole explanation, even if a family member's taking notes and they're writing furiously, they're like, everybody's terrified. And our nurses will come in wherever you want us to meet you, either in your home, at Starbucks, in the parking lot, at this kid's school, and they will go over with you your diagnosis, what your symptoms are, your treatment options, pain management, nutritional guidance. Like you may not feel hungry, but you still have to keep your strength up. So it's really an amazing agency because we offer all of that, remember, at no cost.
So do you work with the patient's doctor? Is that, once I'm diagnosed, someone's diagnosed, then the doctor that's diagnosing me, actually hands me off usually to an oncologist, right?
Mhm.
And then with that is your program would meet or talk with the oncologist, and then so the nurse can explain in layman's terms
So
what's happening.
we are a partner with your
Yes.
medical team.
Got it.
And often what happens is that we are called by the patient navigator, the cancer patient navigator at a hospital, but we can also be referred directly by patients. They'll call our phone number or they'll see us on the website, or perhaps they're in outpatient treatment and they, that agency, that treatment center will call us, or they'll see a pamphlet. We get referrals from all over, but we, of course, are not going to make any treatment decisions for the patient, but we're there to help them understand, because they really often need education. That's a major portion of the support. Sometimes that's the support, and sometimes it's a shoulder to lean on.
And I would think mental support as
There's
well,
no
right?
question. I mean,
Counseling and
we have, so of course in the Westchester community, we treat anyone of all walks of life. Cancer doesn't discriminate.
That is true.
You know, so we see people up and down the education spectrum, the color spectrum. We see people who are, young, and we see people who are very old. We treat them from the time of diagnosis through end stage, and we are there to partner with them and with their medical team, and we help them figure out what kind of help they do need. And in some cases, they need help with maybe getting government benefits because, they worked part-time and now they can't work at all, and now maybe they can apply for food stamps or for Medicaid, disability. We have case workers who will help them do that and go with them to the Social Security office. And we provide all of these services in English and in Spanish.
That's amazing.
I think, especially like all these forms that people have to fill out, and you're going through, the mental state of mind of knowing that you have cancer and where are you going to go, what's going to happen. To have to go through the financial, listen, we know, we experience this with some of our friends, and it is not easy. I mean, you get diagnosed and you lose your job, and that has happened. What do? You are a mother and you have kids and you're the main supporter, and now what do you do? And I like you brought this book that has a lot of other services, right, where people can, we're going to keep copies here if anybody wants to, but we're also on the post, when we do the post, we want to make sure that we put a link to your website.
Beautiful. Thank you.
And we also like to put a link on our website to your website so that
I would love to do that.
people know that they can
Absolutely.
go and get this information.
We're a great resource, and we one of the things, of course, that we offer is this Lifelines publication, which you can find out where to get a wig, what summer camp to send your child that specializes in parents who have cancer. It's filled chock full with local and national organizations and businesses, etc., that are cancer related, and we put that together. But of course, pardon me, we also have a library at our office and on our website. Excuse me.
That's okay.
So we're also a resource from the perspective that when you call us and ask a question, we try very, very hard to find that answer. Sometimes people will call us that are not from the area because it's only Southern Westchester, but we try really hard to be able to say, well, why don't you call this agency? We are a very good referral service. And the other thing is, we try not to duplicate efforts. There, as you said earlier, there are a wonderful number of agencies all over Westchester that help people in need. And so we know of other agencies that offer different kinds of support groups, for instance. We've been running a support group for ovarian cancer patients for over 20 years. And as a matter of fact, recently we did an article about the group, and one of the original patients, she, bless her, is still alive 20 years later.
That's awesome.
We just felt so great. So we do one for ovarian cancer. We just started one for cancer and anxiety. Lord knows.
That is big.
Yeah, and it's not just for patients, it's for patients and caregivers, family members.
I was going to ask you that.
Absolutely.
So family members, you are a resource for them too. It's not just the patient.
Oh,
I would
absolutely.
think so.
Yeah.
It affects everybody, right?
Yeah.
And in terms of counseling, our social worker will absolutely see the family member. In other words, you don't have to come with the patient. We will offer the service just to the family member, because when a person is diagnosed with cancer, the entire family is affected.
And you know what's amazing is what you said, is that you don't think about all of the things that will affect you.
Mm-hmm.
Like, for example, you're saying we find a camp that's right, that has for children that have parents with cancer. Who would even think of that?
Mm-hmm.
You know, there are so many, but at the end of the day, that child is going to need that support, because he's dealing with a possible loss of a mom or dad.
What I'm also finding is that cancer doesn't happen in a vacuum. So you will find a family that already has problems, issues in life, right? Maybe they're homeless, or maybe the mom is underemployed, or whatever the issues are. That only gets harder and worse when a person is diagnosed with cancer. And so a lot of what we do is to help make that experience better. So strangely enough, we find clothing, and we find food, and we find resources. That's who we are. We find the support to help that family be just a little bit better.
That's a beautiful organization.
I mean, we look back, about a year ago, and I was trying to help someone, and I did not know. Like, I don't know if I called it Leukemia Foundation, and they guided us, but we needed a lot more guidance. And so knowing that you exist, I mean, so you said you've been, how many years, the organization?
So, 40 years ago we started, and Dr. Arnold Wald was an oncologist working in radiology, and Gail Lee was a registered nurse, and they worked together. And around that time was when the hospice movement was starting. And so go back to the late 70s, right? Many people were not surviving cancer, and hospice wanted to make end stage, end of life more comfortable. And the two of them were very forward thinking, and they said, wait a minute, we like that idea, but we think a person at any stage of cancer deserves to have an easier time. And anything that can be done to make that experience more comfortable, we'd like to provide that. And so they started very small, and it grew and it grew and it grew, and here we are now, and we have a staff of 12 people, and I have 3 full-time nurses, 1 part-time, 1 who is Latina. We have 2 full-time case managers, both Latina. And we have a social worker as well, and then we have administrative staff and myself and so forth. But it's we're a very busy agency.
And you're just in Southern Westchester, you
That's
said.
right, yeah.
So,
Are there other organizations like this one that exist in other counties?
Nothing that I know that's identical, but obviously we partner with many wonderful organizations.
Yeah.
There's a very strong cancer coalition here in Westchester County. So, we work with Gilda's Club is fantastic, and they run numerous different kinds of support groups. So we don't duplicate that effort. We send the patients who would need that help to Gilda's Club. We work with Westchester Jewish Community Services, also a wonderful service agency that has lots of different components, and they refer to us and we refer back to them. They have many mental health clinics and so forth, pathways to care. You were asking earlier about home health aides and that sort of thing. Clearly we don't work in that arena, but there are many agencies that are available. So we try very hard. Look, we can't make the cancer go away, but we can make it an experience that's a little bit better, and we can try to bring a smile to someone's face at the end of the day.
But you're also there to say, you know what, we don't handle this end, but let's reach out to Gilda's Club.
That's
or
right.
Gilda's
That's
or,
right. Absolutely.
or the home health, the visiting nurses, whoever it is that's going to provide the things that you don't. You're kind of like the care coordinator for the cancer patient.
That we try, it depends on the situation. Some people have that part all together, and yet they really need help with something with their child, because it's affecting not the patient herself or himself, but they have a younger person in their life, and they really feel like that person could use one-on-one counseling, and we will provide that. Or for instance, let's go to, you know how ridiculous it is, because Form A is based on the whole concept of making sure that people can afford care at a reasonable, excellent care at a reasonable cost, right?
Correct.
So the whole issue around insurance, as you well know, is very difficult, especially for numerous people here right here in our county. And so when you think about it, we don't take insurance, we don't get paid. So we can see people as often as they need to be seen, we can stay as long as they need to stay, but I wanted to go back to the fact that sometimes people even with insurance can't afford or are not being offered a particular drug because the insurance won't cover it. 3 out of 4 of our patients are what we call medically underserved. Now, does that mean that some of them are also on the lower end of the money spectrum? Yes, of course. But it also means that they are your neighbors and my neighbors, and their insurance will not cover certain things, and therefore they have to pay out of pocket. It's a agency that helps those people as well, with numerous kinds of things, including we of course try to offer small financial grants. We have great, wonderful benefactors, or we get grants from different agencies that are specific for that, to try to help people who need medication, medical supplies, those kinds of things.
And those medications, they're based on cancer medication. So everything
Co-pays,
is
yes.
because one of the challenges that we find here, I don't know if you remember, Dr. Middleton was saying how there are patients that have asthma, and they need certain type of inhaler, but it's too expensive, so they cannot afford that. So he has to prescribe something else, but it's not going to have the same effect.
Right.
And that's the challenge that we have. We're coming out with our own nonprofit, our Promise to Aid, that hopefully within a few months we'll be able to have our first party. We'll let you all know
That
so you can
sounds
come and
great.
join us.
I'll be there, no question. That'd be wonderful.
Promise to Aid is going to be able to subsidize some of those medications
That's
and
great.
surgeries
Medical
and
needs.
medical
That's great.
needs that our patients have, and unfortunately, they're not able to afford it.
Well, I mean, we find also, our grants are small. I don't want to oversell it. But if a person, for instance, because they can't work this month, can't pay some of their rent, we're going to try to help them there as well. So cancer affects everything, and therefore, when you have a diagnosis of cancer, we're going to come in and try to, help you in whatever area it is. Sometimes it's household bills, or sometimes it's paying the heat in the winter, and sometimes it's co-pays.
I think that's amazing. That's why, I go back to the concept. I hear my daughter the other day was saying, you have to be so careful nowadays. There's a lot of bad people out there. And I said, you know what? There's so many good people out there. And I think one of the most gratifying things for me since I joined this beautiful woman, my partner in crime, and we took this journey of really figuring a way out how to get access to our community that doesn't have insurance, to healthcare, and so much more. But what I found is that my heart is overflowing with joy to see that there are organizations like yours that are making such an impact. And when you say, you said it's a small grant, I don't want to oversell it. Whatever it is, small might be small to us, but to these families that need it, it is.
There's no question. I 100% agree. I mean, I found out about you looking at 914 Westchester, and I was like, wow, I love what these women are doing. And I was like, I have to reach them. And I called and I eventually found an email.
And we are so happy you did.
Because I said, you're very dedicated to the same kind of thing that we're dedicated to, which is making sure that people in our community all have excellent health care and help. Because really think about it. You get a cancer diagnosis, and then if you don't have insurance, it's a really tough time.
It is tough.
Really tough.
That's why we also team up with the Hudson Hudson Valley Cancer Program.
Good.
And they've done amazing things for us. They treated last year about 150 patients. Where we're doing preventive care, because that's the idea. They're helping us get the fit test, which is something that you can do instead of a colonoscopy. If you're not able to pay for a colonoscopy, at least the fit test is a stool test that you do, but they perfected it a lot.
Have you seen the cute commercials?
On the fit test?
Yeah,
No.
they're very cute. Yeah.
Well, I'm gonna have to see that.
They're a little annoying, but they're cute.
You know, that's why
we're talking about it, so they say, you know, if you talk about it with a negative or positive,
it's
it works.
true.
It works.
It's true. Look, my grandmother had colon cancer. You know, it runs in my family, so I've been through not that test too, but colonoscopy. You know, I have to. But you're right. Prevention is huge, and
we talk about that all the time. You know, get it in the early stages, and the people that we did send to the cancer service program, actually 5 of them were diagnosed.
Wow.
And
That's
actually
great.
caught them at an earlier stage.
You must feel so
that's
the bottom line.
But
right?
that's the whole thing when we say, guys, you have your appointment with the gynecologist, don't not show up. You know, it's so important to get these tests done.
Yes.
And then until they all of a sudden they hear the word cancer, like, well, when did this happen? Well, you haven't been to the gynecologist in 9 years.
Well, you know, I think. Oh my God. You know,
like, when did this happen? Or what?
Yeah.
Why me?
But it's the other thing, you know, this is why we do the Facebook Live. You were saying, like, how did we started doing these things? And we are trying to think out of the box. How do we communicate with our community? And we realize that, you know, Facebook is a tool. All of these social media platforms like LinkedIn, even LinkedIn. You know, I've been blown away with LinkedIn. There is so much that, you know, we are putting out there on LinkedIn, and people are noticing it, and people are asking questions, and they know. So, you know, one day, I remember being here at the beginning when we started the medical membership program, that I had this lady, I will never forget, this Mexican lady that, you know, we're telling her, you need to have a mammogram. She's already turning 50, and her sister had cancer, breast cancer at the age of 40.
Oh my.
And she never had a mammogram. So, but it's ignorance. They don't know. And that is why we are starting to pick up this campaign that's called Did You Know? And I mentioned it to you. I said,
I'm going to write something. I'm going to be all over that.
Awesome.
Absolutely. You know, it's interesting. I wish they had that fit test for instead of mammography. I mean, obviously mammography is the standard, and sonogram, etc. But having been that every year, it's not a fun experience.
It is.
You just
But
have to
it's very quick.
Yes.
You know, the nice thing is that they're very lovely when they, you know, the women that
There's
are helping
no question.
you.
Absolutely.
And it's very quick.
They're very nice.
Hold your breath for a couple of minutes.
You.
Yeah. So you hold your breath for a few minutes, but it's so worth it.
Oh, no
So
question.
worth it.
There's no question.
I mean, it's some of these cancers. We were talking about the colon cancer, and I think it was this last month or this month. It was colon cancer awareness month.
Yes, it is.
And we invited our medical director to one of our shows, and he was talking about how this cancer is so preventable and is so treatable. And but if
when
you
caught early,
when caught early, it's one of the most successful cancers when they're caught early.
You know, another one that we should talk about, since we were talking about mammograms, is prostate cancer. And a lot of men, and in particular men from certain cultures, do not want to have the test. And they're very, again, it's quick, it's over and done with. You know, and guys need to know that if women have gynecologic exams, they can handle having an exam too. You know, and I really, you know, certainly that needs to be addressed, because that's also a not necessarily preventable, but if caught early, the prognosis is wonderful. And so it's something that men need to take very seriously and really handle.
There. So men out there, I know you guys don't like to go to the doctors, even for checkups. But we want you to live longer. See, one of the reasons I think also that women live 7 years more than you is the fact that we are aware that we need to do our physicals, that we're more aware of that. Not just that, I think we also speak.
No, I think some of us actually drive our husbands to their grave. You know, they try to get away from us as much as possible, so they're like, okay, just what else can I do to get out of this marriage? But, you know, I want to give you your telephone number.
Please, absolutely.
So, you know, again, it's the Cancer Support Team, okay? And you can reach them at cancersupportteam.org. And then it's 914-777-2777. How difficult is that? 914-777-2777.
Thank you.
Now, are you, is it like a 24-hour that they can hotline, or?
Sure, if there's an absolute emergency, we do of course cover the phone 24 hours a day, 7 days a week, but primarily it's 8:30 to 4:30.
Right.
And I should also mention that we have a whole team of volunteers. That's something I didn't get to talk about before.
Yeah.
And we're always looking for volunteers, of course. So we have, I mentioned that we help people go to and from their treatments, for getting to and from their treatments in Lower Westchester, and we have volunteer drivers, and those drivers develop relationships with those patients. It's wonderful. But they also they help us with office type stuff, and they also do friendly visits. They do errands. They go grocery shopping. We really rely on our volunteers, and that's great. So.
Well, there is a lot of people. Actually, one of the shows that I was thinking to do, it was actually on volunteering. And that there are so many different organizations because we all have different passion, right? So you want to volunteer where you connect with. So that's a show that I wanted to talk to you about that we should have.
I think it's
because there is a lot of people out there that want to volunteer. They just don't know
where to go.
So we if you're interested in helping out, please reach out to them. We are going to put the telephone number and the information on the post, so that people can reach out. They're also going to be on our website, so you'll be able to get the information from there. But give back, right? Pay it forward. So if you're healthy and you have time, pay it forward.
And whatever time you have.
Yeah.
It's not like you have to donate, the next 10 hours every week. But whatever time you have, put yourself out there for somebody else.
It makes you feel good too.
It definitely does.
I'm listening to a book, The Happiness Equation, and it actually they give you a lot of different ways that you can make yourself happy, and one of them is giving back.
There's no question.
Sure.
And they say for 5 people you help, like the joy that you receive is great. And we are living it. I mean, people tell us, why do we look so happy all the time?
Because we drink heavily.
She's a joker, as you could tell. But no, we just, we're living every day we wake up. We know we're making a difference. And that makes it easier for you to take on challenges, because it is not easy, even working in a nonprofit or working in a business.
And we deal with cancer. I mean, think about my staff deals with nothing but people who have cancer.
Yes.
All day long. It's, obviously very, very hard. And yet we are a joyous and wonderful office of people who feel happy because the work they're doing makes such an impact in the lives of the people they're working with.
That's
There's
beautiful.
no question.
Yeah, it really
Well, you
is.
obviously can see that she has a lot of passion for this. And
I do.
I love meeting people with passion, and because passion is contagious.
That's right.
Yes, definitely.
And you can get results when you have passion. So obviously you're getting results, and we are very happy that you got your new role.
Thrilled. Thank you so much. This is
Congratulations.
great. And
Congratulations.
I love what you're doing here. I mean, I love the show. I think the show is great, but I think Forme is wonderful. What a great idea.
Thank you.
We're very happy. So you heard that. We are great, and hopefully you feel the same way, and you continue letting people know that don't have insurance or have insurance to come here. The idea is, insured or not, we got you covered.
Right.
Right, partner?
Absolutely. We are here for you.
Okay. So we had, I think it's done.
Yeah.
30 minutes go so fast always. Tania, we want to thank you for joining us and taking the time.
Thank you so much.
And we will take these brochures, so you can reach out to Tania, to the organization directly. If you guys missed it for any reason, you can call us and we'll connect you.
Thank you again. This was wonderful.
Take care.
Thank you.
Remember, if you like the show, please like us. Take care. Bye-bye.
Bye.